Welcome back, my dear friends, and now we are actually going to start with the next topic. The next topic is thorax topic, and I'll first of all tell you like how we are going to approach this topic here. In thorax topic, first we are going to learn about the thoracic wall, and thoracic wall anteriorly will be having sternum here, and posteriorly will be having the vertebrae, that is thoracic vertebrae, and then laterally will be actually having the ribs here, guys. So the sternum and posteriorly the vertebrae and the ribs. In between the ribs will be having intercostal space, and together this is the one which is actually going to form your thoracic wall, entire thoracic wall. Now after learning everything regarding this thoracic wall, then we are going to move inside, and inside the thorax we are going to learn about the organs there. One will be your heart, and then the lungs, and the other structures we'll study in detail, guys. That is how, in a very simple manner, we are going to approach the thorax topic. So first, to begin with, on the screen you are able to see the diagram that is of thoracic wall here. Let's learn about that in detail here, guys. So first topic to begin with in thorax is thoracic wall. In thoracic wall, anteriorly you will be having sternum. Anteriorly there will be sternum, and then posteriorly we will be having vertebrae, that is thoracic vertebrae, and then finally laterally you will be having the ribs, guys. So the sternum, then the vertebrae and the ribs, anterior, posterior and the lateral side, guys. Now out of these three, let us just deal with them one by one here. First of all, with the anterior aspect, guys, that is sternum. Now about the sternum, we don't have to learn anything here, guys, not much to study about the sternum. At this level, everyone knows that it will be having like three parts. There will be a manubrium sternum here, and then we'll be having the body of the sternum here, and this will be the xiphoid process. Now one important point I would like you people to make a note here. Between the manubrium sternum and body of the sternum, there will be a joint here, and this is actually referred to as sternal angle. This will be the sternal angle of Louis. It is sternal angle of Louis. That's an important landmark in this sternum topic here, guys. That is one thing important to be remembered about. So between the manubrium sternum and the body of the sternum, that joint is actually referred to as sternal angle of Louis. Now from that sternal angle, if you just draw an imaginary line posteriorly, it will go and meet with the lower border of T4. If you draw an imaginary line posteriorly, that will actually go and meet with the lower border of T4. And that imaginary plane has got a lot of importance. And we'll again come across that one when we'll study about the mediastinum topic and all. It is dividing that superior mediastinum, inferior mediastinum, and there are so many structures crossing at that plane. We'll study about them. So for now, just concentrate on the name. So what is that name, guys, between the manubrium and body of the sternum? That is sternal angle of Louis. Now one more important thing to make a note here, which rib is coming and joining at the sternal angle. So in the diagram you can see very clearly, crystal clearly, that is the second rib here, guys. Second rib will be coming and joining. To be more precise, the costal cartilage of second rib is coming and joining at the sternal angle of Louis. Done. So those are the important points that you have to remember about the sternum. Now what about the vertebrae? Vertebrae, nothing to discuss over here, guys. Thoracic vertebrae, there will be totally 12 in number. And in general anatomy part, I will actually teach you about how to differentiate between the cervical, the thoracic and lumbar vertebrae. So we don't have to discuss about that over here. But now we have to discuss in detail about the ribs, guys. So let's begin with the topic of ribs in detail here. In total, how many ribs do we have? We have got totally like 12 pairs of ribs. Now out of these 12 pairs of the ribs, remember all these 12 pairs of the ribs are divided into two categories here. One, you'll be actually having true ribs, and the another one will be having the false ribs. Ribs, all the 12 pairs of the ribs are divided into two categories, true and false. Then out of the 12 pairs, remember rib number 1 to rib number 7 will be actually the true ribs, and then rib number 8 to rib number 12 will be the false ribs. Rib number 1 to 7 will be the true ribs, and 8 to 12 will be the false ribs. Now I want to understand here like what is the difference between these true ribs and false ribs? What are these true ribs? What are the false ribs? To understand that, let us do one thing. Let's draw a small diagram here. For example, if this one here will be the manubrium sternum, then followed by that this is the body of the sternum, and this here will be the xiphoid process, sternum. And then behind, what do you have? Behind will be actually having your vertebrae, the thoracic vertebrae. I am not drawing the exact diagram of that, try to understand. That's your thoracic vertebrae. So try to understand this, like anteriorly will be having sternum and vertebrae are present posteriorly. Then what about the ribs? The ribs are actually going to begin from the vertebrae behind, then take a turn and come and get attached to the sternum. So therefore, this is how the ribs are going to begin from the vertebrae, take a turn and come and get attached to the sternum here. Now, will the bony part of the rib attach? No. The ribs are attached to the sternum with the help of small piece of cartilage. And remember, that cartilage is referred to as the costal cartilage. That is the costal cartilage here. So the ribs are actually going to begin from the vertebrae behind, then they are going to take a turn and come and get attached to the sternum with the help of small piece of cartilage, that is costal cartilage. Now guys, before moving ahead with our topic here right now, let me just take you back to the cartilages, types of cartilages. I hope you are able to recall from general anatomy. We have three types of cartilages: hyaline cartilage, elastic cartilage and fibrous cartilage. So out of the three categories of cartilages, tell me, costal cartilage belongs to which category? Is it like hyaline variety or elastic cartilage or fibrous cartilage? And yes, remember from here itself, costal cartilage is one of the examples of hyaline cartilage here. Costal cartilage is one of the examples of your hyaline cartilage. Just to recall the examples here itself, guys. Now coming back to our topic, yes, exactly the same thing is happening right from the rib number 1 up to rib number 7. So right from the rib number 1 up to rib number 7, exactly the same thing. I mean to say, they are going to start from the vertebrae behind and then they are going to come and join with the sternum in the front, 1 to 7, rib number 1 to 7. Exactly the same thing. And these ribs are the one which are said to be the true ribs. So true ribs are those which are coming and getting attached to the sternum here, guys. Therefore, we can even make like another name of these true ribs here. The true ribs are going to begin from the vertebrae behind, that is why vertebro, and they are coming and getting attached to the sternum. That is the reason why sternal, vertebro-sternal ribs. So the true ribs, we can also call them as vertebro-sternal ribs. Makes sense. Now after this, let's move to the false ribs here, guys. False ribs will be 8 to 12, and these false ribs 8 to 12, we can again divide this into two categories here. The false ribs, we can again divide that into two categories here. That is the rib number 8, 9 and 10, and then the rib number 11 and the rib number 12. 8, 9 and 10, and then 11th and 12th. Now my dear friends, let us see what is the difference. Rib number 8, again it is also starting from the vertebrae behind and then taking a turn, and then rib number 8 will come in the front and its costal cartilage will be attached to the costal cartilage of the 7th rib. Then the rib number 9 will also come in the front, but its costal cartilage will be attached to the 8th one, guys. And similarly, the rib number 10 will also come in the front and its costal cartilage will be attached to 9th one. Oh my god. So what I am trying to tell you here, that rib number 8 and 9 and 10, these three ribs, they are going to start from the vertebrae behind and they are coming in the front, and their costal cartilage will be actually attached to the previous rib. So 8th will be attached to the 7th one, 9th will be actually attached to the 8th one, and 10th will be again attached to the 9th one. So their costal cartilage are not getting attached to the sternum, they are actually attached to the previous costal cartilage. Okay. What should be the name of these ribs here? 8, 9 and 10. They are starting from the vertebrae behind, so that is why vertebro, and they are coming and getting attached to the cartilage. Now recall, what is the another name of the cartilage? It is also known as chondrus. So that is why vertebro-chondral ribs. They are known as vertebro-chondral ribs, 8, 9 and 10. Now the last and final ones are the 11th and 12th rib, and that is a very famous one. Every student knows that the 11th and 12th ribs will not at all come anteriorly. Their ends will be remaining free behind, and that's the reason why these two are referred to as floating ribs. So I want you all to actually focus on the numbers here, guys. So in total, how many ribs do we have? 12 pairs. The true ribs will be 1 to 7. False ribs will be 8 to 12. And out of that 8 to 12, 8, 9 and 10 will be vertebro-chondral ribs, whereas 11th and 12th will be the floating ribs, guys. That is the entire story regarding the ribs here. I hope this diagram will make it easy for you people. Now the next thing, one more thing here itself, guys. These costal cartilages, the costal cartilage of the 7th rib and the 8th rib, the 9th and the 10th one over here, and exactly the same on the other side also, will be forming a margin here. So if this is the xiphoid process here, from the xiphoid process, the 7th, 8th, 9th and 10th, the costal cartilages, they are forming a margin, and this margin is referred to as costal margin. Costal margin, guys. Perfectly done. So this is all the information that you have to know regarding the thoracic wall. That is just a beginning of the thorax topic, say, like an introduction here. So in the thorax topic, the thoracic wall, we are done with the sternum, the vertebrae and the ribs. It is just the starting, the introduction of the thorax topic. And now let's start with one of the most important topic in thorax, in between the ribs. In between all these ribs here, you are able to appreciate the space, and that space is nothing but the intercostal space. Now slowly we are moving towards the most important topic, guys, in thorax. So in between the ribs, you are able to appreciate one space here. That space is referred to as what, guys? Intercostal space. So above here you are able to appreciate one rib, and below there is a rib. In between them, the space here is referred to as intercostal space. Perfect. And to make this topic easy, this topic is also not all difficult, guys. To make this topic easy, you just have to remember like 3 points here. Point number 1, intercostal muscle. So, we will be having like 3 categories of intercostal muscle here. Number 1, there will be external intercostal muscle. Number 2, there will be internal intercostal muscle. And number 3, you will be having innermost intercostal muscle. Hope you are able to appreciate there. So, external and then internal and then the innermost intercostal muscle. Repeat again, external, internal and innermost intercostal muscle. First point to learn. The second point to learn here is, where do you have the neurovascular bundle? I mean to say the nerve, artery and the vein, where is it present? And you can clearly see in our diagram over here, it is actually between the internal intercostal muscle and innermost intercostal muscle. I and IM, internal and innermost. Between them, you are able to appreciate the neurovascular bundle here. Perfectly done. Now the last and final third point, remember here, you don't even have to learn the names of this artery, vein and nerve. The names are very simple: intercostal artery, intercostal vein, intercostal nerve. So don't even concentrate on the names there, concentrate on their arrangement. Arrangement is important. So in this diagram here, you are able to appreciate, first you will be having vein, and then there will be artery, and then there will be nerve. Intercostal vein, intercostal artery and nerve, and they are arranged in the form of van, above downwards, in the form of van. That's all. So these are the 3 points that you have to learn in the topic of intercostal space here, guys. So now, after explaining you everything, the entire concept is very clear. Let us just finish off this one by writing the notes here. Come on, start writing along with me. So the next topic that we are learning is intercostal space. In the intercostal space, point number 1, you will be having the intercostal muscles. And those intercostal muscles are divided into 3 categories here. One will be the external intercostal muscle. Number 2, you have got internal intercostal muscle. And number 3, there will be the innermost intercostal muscle. Innermost intercostal muscle. External, internal, innermost. And one thing I would like you people to add here is that innermost intercostal muscle is not a single muscle. It's actually a combination of 3 muscles together. So 3 muscles together collectively are known as the innermost intercostal muscle. Now which 3 muscles are those? Number 1, just behind the sternum here, that will be sternocostalis. Sternocostalis muscle. And then just in front of the vertebrae, I mean to say behind, you'll be actually having subcostalis muscle. Subcostalis muscle. And in between the sternocostalis and subcostalis, there will be intercostalis. Intercostalis intimae muscle. So there will be sternocostalis, subcostalis and intercostalis intimae. And don't get confused right now. For now, you just write down. I'll even make you draw a diagram for this one also. Things will become easier. Achha, one more thing here. Out of these 3 muscles, which muscle is referred to as transverse thoracic muscle? That's an important thing here. So remember, sternocostalis muscle is the one which is also referred to as transverse thoracic muscle. Now why I am stressing a lot at this point is, in certain books it's given wrongly. They are referring the transverse thoracic muscle to some other muscle. But remember, the final thing, it's given very very clearly in the Gray's Anatomy textbook. The transverse thoracic muscle is another name of sternocostalis muscle. A point to take a note about. So that is our first point done here, intercostal muscle. Now welcome to the next point. So second point, neurovascular bundle. Now where exactly do you have the neurovascular bundle, guys? Remember, the neurovascular bundle is between internal intercostal muscle and innermost intercostal muscle. Internal intercostal muscle and innermost intercostal muscle. There you have the neurovascular bundle. And the point number 3 here, I told you, don't even remember the names of that nerve, artery and vein, you just have to remember their arrangement. Now what is the arrangement of neurovascular bundle? First of all, the neurovascular bundle is arranged above downwards. Above downwards. And then in that arrangement, remember, first you will be having vein, intercostal vein of course, and then there will be artery, intercostal artery, and then you will be having the intercostal nerve. It's arranged in the form of VAN, above downwards, intercostal vein, intercostal artery and nerve. But there is an exception. In all your intercostal spaces, in every intercostal space, the arrangement will be in the form of VAN except for the first intercostal space. And in the first intercostal space, it's easy, just make it vice versa, ulta. Okay, so except the first intercostal space, and in the first intercostal space it will be in the form of nerve and then the artery and vein. So make the topic easy guys with the help of 3 points here, that's all. Intercostal space, you just have to remember these 3 points. Done. Now after completing all this, now let us do one thing here, let's draw the diagram also so that we can remember for a longer duration. So imagine this one to be the upper rib, we are drawing in the same section, and imagine this one here to be the lower rib. So out of all that intercostal spaces, I am like taking any one intercostal space, we are just zooming that once. So upper rib and the lower rib. Now the first point here, there are 3 intercostal muscle. One will be the external intercostal muscle here, and then there will be internal intercostal muscle, and then there will be innermost intercostal muscle. Let me just write down in short here, external and then internal, and then there will be innermost here. Now between the internal and innermost, you will be able to find the neurovascular bundle, the nerve, artery and the vein. But how they are arranged? So first you will be actually having the vein here, intercostal vein, and then you have got the artery, that is intercostal artery, and then there will be nerve, that is your intercostal nerve here. So vein, artery and nerve, van arranged above downwards. So that one simple diagram will make the entire topic easy for you. So if you just look at this diagram, you will be able to tell every point regarding intercostal space guys. Done. Now after this, what is the use of learning this topic? What is the application of this one? What is the clinical application? Why do you have to learn about this topic here? I hope you have heard about pleural effusion a lot of times. Pleural effusion, accumulation of fluid in the pleural cavity, abnormal amount of fluid in the pleural cavity. Now to remove that fluid in the pleural cavity, okay, to treat that pleural effusion, what you are going to do? You are going to take a needle, insert the needle and take the fluid out, and that is nothing but pleural tapping. Now there has been a question asked already in the exam. When you are doing the pleural tapping, the needle has to be inserted where? Where the needle has to be inserted? I'll give you like 2 options here. Option number 1, the needle has to be inserted just below the upper rib. Option number 2, the needle has to be inserted just above the lower rib. Below the upper rib or above the lower rib? What is the right answer? I hope you can clearly understand from our diagram here, the needle should never be inserted below the upper rib, sir. Why? Because if you insert the needle just below the upper rib, there are chances of damaging the neurovascular bundle. That's the reason why the right answer for that one is insert the needle just above the lower rib in pleural tapping. So therefore, write down there as applied aspect. Let us see what is the application of this topic here. Number 1, in pleural tap. So whenever you are going to do the pleural tapping for pleural effusion, in pleural tap, remember the needle should be inserted above the lower rib. That's the right answer. Just above the lower rib. That's the right answer guys. In pleural tap, the needle has to be inserted just above the lower rib. Now one more important MCQ that has been asked in the exam, when you're inserting the needle, which muscles are going to be crossed one by one in sequence? Which muscles are going to be crossed like one by one in sequence guys? So to make you understand that more clearly, let us do one thing. Let's draw a diagram, and that too we are going to draw the diagram in the transverse section here. So let's draw the diagram in the transverse section, guys. And in the diagram, the things will become very clear. When you're inserting the needle will be crossed one by one, guys. So first of all, you imagine this one here to be the thoracic vertebra here. And then anteriorly, what do you have here, sir? Anteriorly, there will be sternum here. Now, why is this sternum visible in this manner? We all know sternum is actually a flat bone. It's a flat bone, and I'm taking a transverse section. So in transverse section, it's visible in this manner. Now let us see about the muscles right now, guys. First of all, you'll be having external intercostal muscle. So imagine this one here to be your external intercostal muscle. Okay, there will be even a membrane there, guys, but right now that is not our concern, that is not our topic right now, sir. So later on I'll even tell you more specifically about that membrane also, but for now you just imagine that is external intercostal muscle. Now inside this one you'll be able to find internal intercostal muscle. So external and internal intercostal muscle. Simple. These two muscles are like one complete muscle, guys. Now when it comes to innermost intercostal muscle, I said you very clearly in the notes, I made you even write down innermost is not a single muscle. It's actually three muscles together. Now where do you have that? Just a schematic diagram here. There will be one muscle over here behind the sternum, that is sternocostalis, and then one muscle over here just near to your vertebrae, that is subcostalis. In between them, you will be able to find the intercostalis intimae. Wow. So let us just write down the name now. So nearby the vertebrae, you are having subcostalis muscle, and this one here will be the sternocostalis muscle. And I told you even the another name of this one, it is also referred to as transverse thoracis, keep in mind. And then in between these two, you will be able to find the intercostalis intimae. Intercostalis intimae muscle. And these three together are nothing but the innermost muscle. I mean to say the innermost intercostal muscle. Perfect. So in the transverse section, we are able to perfectly understand all these muscles here and their arrangement. Now one more thing, try to recall from upper limb topic. In upper limb topic, I taught you about the boxer's muscle, and boxer's muscle is nothing but your serratus anterior muscle, guys. Serratus anterior muscle, and we have learned very clearly in upper limb topic, serratus anterior muscle will be attached to that upper 8 ribs. I mean to say it is also attached to your thoracic wall only. So because it is attached to thoracic wall only, yes, you will be able to appreciate the serratus anterior muscle here on the outer side. Serratus anterior muscle or the boxer's muscle. Then after that, let us just finish off this one with the two fascia on the inner side. Yes, first of all, you'll be actually able to find here endothoracic fascia, and then you'll be able to find the pleura, and of course there will be parietal pleura here. So I'm just writing ET here, that is your endothoracic fascia, and this one will be the parietal pleura. Let me write down here. So this one is endothoracic fascia, and then the parietal pleura. Parietal pleura. I'll tell you what is the reason why I'm mentioning these two layers over there. Now let us insert the needle. Now when you're inserting the needle here, let me take another color here. When inserting the needle, now I don't even have to teach you. Now you don't have to mug up here, guys. Just look at that beautiful diagram there. So first of all, the needle is going to cross serratus anterior muscle, next external intercostal muscle, next internal intercostal muscle, and don't say innermost intercostal muscle. It's not innermost, it's only the intercostalis intimae muscle, and then the endothoracic fascia and the parietal pleura. And the moment you cross the parietal pleura, you are right in the pleural cavity where abnormal amount of fluid has been accumulated, effusion, pleural effusion, and you are going to aspirate that fluid out. You are going to remove the fluid out. That's nothing but pleural tapping. Is it okay? I repeat again once more. In pleural tapping, let me just write down here. In pleural tap, like what are the muscles which are crossed one by one? What are all the structures crossed one by one? So number 1, serratus anterior muscle. Number 2, external intercostal muscle. Number 3, internal intercostal muscle. Number 4, you have got intercostalis intimi. You have to be like really careful there. And then there will be endothoracic fascia and then the parietal pleura. So all these structures are crossed by the needle one by one. And please don't go beyond that one. If you take your needle beyond that one, visceral pleura, and visceral pleura is closely adherent to your lung and you will be damaging the lungs. That's dangerous. Okay. So these are all the structures crossed by the needle in the pleural tap. Now where exactly the pleural tap is being done, guys? Is the pleural tap done? Now where exactly is the pleural tap done, guys? Is the pleural tap done along the mid-clavicular line or along the mid-axillary line or along the paravertebral line? Yes, you can clearly see in my diagram there, the pleural tapping is done along the mid-axillary line here. So please even mention that one. The pleural tap is done along mid-axillary line. Mid-axillary line. And then where exactly? In which intercostal space? So you can do it in the 7th or 8th or 9th intercostal space. So pleural tapping can be done along the mid-axillary line, that to 7th to 9th, 7th, 8th or 9th intercostal space, and from there you can aspirate the fluid out. Okay, so that is the reason why we have to study this topic in anatomy very clearly. Why? Because tomorrow when you go in the hospital and practice, usually like very common that the patients will come to you with a pleural effusion, and this procedure has to be done very commonly, guys, pleural tapping. And I hope now the concept is like crystal clear, and that completes this topic here, guys. Thank you. Done.